Top Med Talk.
Welcome back to Anesthesiology 2017, live from Boston, USA. We're here at probably the largest gathering of anesthesiologists in the world. This is brought to you by Top Med Talk. I'm here with Dr. Joff Lacey. Hi, Joff, how are you?
I'm very good, Monty, thanks.
Colleagues from the UK, and we've managed to hang on to our guest, Dr. Sol Aronson from Duke University Medical Center. Hi, Sol, how are you?
Good, thank you, Monty.
And delighted to be joined by Dr. Brennan, who's the president of the Royal College of Anaesthetists in the UK, our overall leader. I would say spiritual leader, but you know what I mean, Liam. So welcome, how are you?
Monty, it's great to be here in Boston.
So I wanted to take us back, Sol, to that discussion we were having in the last podcast about the extended role of the anesthesiologist and the perioperative medicine, perioperative surgical home, pushing out into these various places, and bring you back to that idea that we seem to be population health, public health doctors as well, and whether that's right and proper and whether we should just get back in the OR and get on with the job that we know.
Yeah, no, thank you for that slow-hanging curveball to really knock that one out of the park. I think it's really important that we do re-identify who we are as members of the healthcare team, particularly in the context of population health, and I don't think it's a stretch at all. On the contrary, I think it's exactly where we need to reorient ourselves within that continuum. Interestingly, Mark McQuillan and I just wrote an editorial that I just finished reading the proofs on, so it should be in press in the near future. Spoke to that concept in the setting of health from birth to death. Obviously, is a very long continuum, and within that very long continuum, perioperative medicine represents a disproportionately small part of that cycle. But on the other hand, interestingly, we both agree that it represents a disproportionately high opportunity to impact value. The cost of health care, once one has to confront the need for surgery, in the broadest scalable sense of that definition, is disproportionately very high. And so as specialists in perioperative medicine, our ability to impact the value proposition is really quite great. And compared to our colleagues in the other primary care specialists and or specialists, I think we shouldn't shy away from that, but embrace that. And I think it really is upon us to represent population health in that context.
Okay, so Liam, from the UK perspective, how do you think that would go down in the United Kingdom?
So I think that already is going down well, Monty. I think we have already started work through the Royal College in the UK, working with our colleagues in public health medicine, the Faculty of Public Health. I met with the president of that organisation, John Middleton, very recently, and we discussed just this. The potential for anesthesiologists to work with our patients at a very receptive point in their health requirements when they're going to require surgery, when we can discuss their lifestyle choices, particularly around smoking, alcohol consumption, obesity, and to say, it's in your best interest now to think about how we can alter those behaviours and be part of that team working with our colleagues in other branches of medicine, surgery, and in the medical specialties to help our patients improve their general health for the benefit of themselves and for the wider community.
So how do we, from your perspective in the UK, we'll get the US perspective in a moment, and then we'll ask somebody who's going to be subjected to this job. Who's going to pay for that, and where do we get the manpower from? Because we're already stretched in the operating room.
So this is part of the work that we are doing with working with the political leadership in the UK for them to value and to understand the potential for anesthesiologists to work with patients, to pay for that time within the tariff system we have in the UK, to commission services, to include anesthesia provider time to work with patients in the preoperative period and not just what we traditionally do in the operating room.
And is it more of a leadership role or a doing role, or a combination of the two?
I think it's definitely a combination of the two, Monty. I think it's changing hearts and minds both for political leadership and for our patients.
The way we've approached this at Duke and the way we're trying to spread, if you will, that model, partly through the Evidence-Based Perioperative Medicine USA program that we're putting forward, as well as just locally, is I think it's a new care model where we have to be and should be more reliant on extenders to enhance our abilities as physicians to take advantage of those teachable moments. I think the point of transition to care is a terminology that we use often in the States. And I think the other thing that's really interesting and important to recognize is many patients that have to confront the reality of surgery being in their near future have heretofore not really been connected to the healthcare system. And the first opportunity they have, that first touch point, if you will, into their health care is because of the confrontation of having to address their surgical need. And our ability to speak wisely and effectively to that teachable moment is really, really critical as perioperative specialists.
So Joff, keep going back to this, you're on that cusp between fellow and becoming an attending consultant. Is this what you signed up for?
Well, it wasn't at the time that I signed up for anaesthesia, but it is certainly something that I want to and excited to be involved with now. I mean, you're talking to the converted here, but we've said this time and time again, but there is such a need for good patient care for perioperative medicine, and we are, as anaesthetists, best placed to deliver that. And if we don't step up to the mark, then someone else will. And I think we can use our expertise to really make a big impact in patient outcome, and that's extremely exciting. And therefore, I'm not. There's a degree of trepidation, I suppose. There's an unknown in some respect, but I'm extremely excited at the foremost, more than anything else.
Top Med Talk. And remember, you can join the Top Med Talk team live at one of our many broadcasts. Go to ebpom.org for more details. We're going to be in London on the 4th to the 6th of July for EBPOM in London 2018. Come along and see us. ebpom.org for more details.